Yeah,
swing them
no, I
and
mean, it can
stuff?
happen when you grab their hands and swing them around like that. You can do it like that too, but most of the time, it's you jerk.
My sister was swinging me like that, but she wasn't using her fingertips, but she was holding
She's
on
holding you.
to my wrists and dislocated my, whatever. I got
Because it's like the whole like
my-
monkey bars thing.
Yeah.
If a kid plays on the monkey bars, he's less likely.
Yeah, they're not likely to do that. It's
Yeah.
usually a forceful thing. If you're gonna pick up a kid like that, it's much better to put your fingers in the ears and lift them up like that.
So, yeah.
That's pretty.
This is something that that you'll need to pay attention to. It's called a fat pad sign. In the distal humerus here, there is a pad of fat in front of and behind the humerus. When you have a fracture, the hematoma occurs underneath the fat pad and lifts up the tissues off of the bone, the hematoma does, and produces a translucency. So if you can see it right here, you see that dark spot right there? And right there? That's called the fat pad sign. It means that there is a fracture in there somewhere. You gotta find it. If it's not apparent, then you better get a CT of the area to identify it. But that fat pad sign means there is a fracture. And you can see the fracture of the olecranon here that's kind of obvious, and there's the fat pad sign right there. Okay, fat pad sign. Means there's a fracture of somewhere in the elbow. When I say elbow, it could be the humerus, the olecranon, the radial head. Yeah.
Would you mind to show?
Oh, yeah, yeah.
I haven't seen that one.
Well, there's the fat pads up there indicated by the arrow. There's a fracture of the olecranon, and there's the fat pad right there. You see that dark spot? Yeah. That's what you're looking for on a plain film x-ray. Lateral and medial epicondylitis. I talked about the origin of the tendons, the flexor and extensor muscles of the hand. Repetitive use of the extensors, like in backhands, playing tennis, produces an inflammation up here at the origin of the tendons, where they attach to the bone. And it's like if you were to take an ice pick and just stick it right in there. That's what lateral epicondylitis or tennis elbow feels like. Golfer's elbow, because the swing is this way, is you're contracting the flexors, and it's a repetitive use tendonitis is what it is. It's a medial epicondylitis. If it's severe enough, you can inject it with steroids, as you see down here. Usually just ice, rest, relaxation, elevation, anti-inflammatories, that sort of thing. Give it a break will usually help. I put this picture in here for two reasons. One is that thing right there is called a tennis elbow strap or lateral epicondylitis strap. And what it is it's a tight strap that you put around the heads of the muscles. So that serves as the origin of the muscles. If you put your hand around there and squeeze it tight and do like that, you can feel how that muscle is contracting against your fingers. So what you're doing is you're taking some of the pressure off the lateral epicondyle. The other and more important reason I put this slide up in here is because that guy looks like such a joke. You know, you would think if they were going to get a promotional picture with this strap, they would have, you know, Federer or, you know, some strapping young buck. This guy, he looks like he belongs on the Partridge Family or something. All right. Anterior compartment of the arm. The muscles are the biceps brachii. Biceps means there are two heads There's a long and a short head. The tendon of the long head arises from the supraglenoid tubercle. The tendon of the short head arises from the coracoid process. I said there were three things that attach to the coracoid process. Pec minor is one, short head of the biceps is another. The inserting tendon right here splits into, one part inserts into the radial tuberosity. The other part forms an aponeurosis and just sort of inserts into the deep fascia of the forearm. If you contract your biceps against resistance like this, so here's the radial tuberosity, you can feel it right there. And then over here, you can feel it even much more right there, how the deep fascia really tightens up with that, okay? The thing about the biceps is that the long head crosses two joints. So the long head has an action to flex the shoulder as well as flex the elbow. The short head, because it arises from the coracoid process and also crosses two joints, it has the same type of action. When we get to the triceps, one of the heads of the triceps arises from the humerus and only crosses the elbow. So you need to pay attention to what muscles have an action on which joints. We know that the biceps crosses two. The other two muscles of the anterior compartment only cross one. The first muscle is the coracobrachialis. This is the third and final muscle that arises from the coracoid, inserts into the humerus. Then the brachialis arises from the humerus and inserts into the ulnar. There's an ulnar tuberosity. It's not as prominent as the radial, so I won't ask you to find it. All of these muscles are innervated by the musculoskeletal neuron off the lateral cord. Not musculoskeletal, musculocutaneous. And you can see it right here as the top M. That's the top M. The posterior compartment of the arm contains two muscles. The triceps has three heads. The long head of the triceps is the most medial. It arises from the infraglenoid tubercle. The lateral head of the triceps arises from the humerus itself. And the medial head of the triceps is deep in there. It arises from the humerus as well. And they all three join as one tendon to insert into the olecranon. So the long head is going to extend the shoulder and the elbow. The lateral and medial heads are just going to have an action on the elbow. There's another muscle. The other muscle in the posterior compartment is this little thing right here. It's called the anconeus. It actually arises from the forearm bones, olecranon. It runs lateral. It's a little triangular looking muscle. It's thin. You know, if you look at the, if you have useful muscles over here and useless pissant muscles over here, anconeus is in the useless category. You know, they describe this big noble function of the anconeus as assisting with extension of the elbow, stabilizing with it. No, it doesn't. It's too freaking small. It's just there. So you'll see it on your cadaver and just think it's an afterthought. It's like, oh, look, somebody stuck a little piece of muscle here. That's the anconeus. Here are the things I was talking about earlier. Here's the long and lateral heads of the triceps. There's the quadrangular space. There's the space where you have the spiral groove with the radial nerve. Here are the muscle actions, the oars insertions, the innervations, muscle actions. These are just self-explanatory. You know, on the test, if I ask you, just sit there and contract them. I mean, you can figure it out without having to memorize this stuff. It's pretty intuitive. There's the Anconius there. They actually thought to give it a picture. They feel sorry for it. And they describe, again, this noble assist triceps in extending the foot. No, it doesn't. This is a rupture of the tendon of the biceps. A lot of times it will be the long head because the tendon is so, it's like a pencil, you know, it's very dense, it's cord-like. And what happens is once that thing pops, it will recoil, essentially. It doesn't recoil like a bungee cord, it just contracts over time, and you'll wind up with this odd-looking bump in the anterior compartment of the arm. A friend of mine came to the house just before Christmas, and he had his arm all in a sling and braced to his body. I said, "What happened?" He's a pretty athletic guy. He was out in Utah. They were 7 miles in this valley, and they were rock climbing. And he was hanging from a rock, and all of a sudden he felt this pop and pain. And it turns out he snapped the head of his biceps, so he and his guys he was with, they had to hike out 7 miles. They had to do white rock water rafting, all this stuff to get out, and him with a ruptured bicep tendon. So, and this was, it took him about a week. Usually you like to repair these things pretty quick. It took him a long time to get back to Oklahoma City, and yeah, it was a mess. Here's what's called a PICC line, a P-I-C-C. This line is placed in the basilic vein and will extend into the brachial vein on up into the axillary vein. If you look at this x-ray right here, you see that little line? You can follow it out here into the soft tissues. That's the PICC line. When you're putting an IV in the back of the hand, these things only last about 2 or 3 days before they have to be changed. A PICC line goes into a larger vein and can stay in place for a considerable length of time. So if you're administering chemotherapy drugs, you need a lot of volume, you don't want the extravasation of the chemotherapy agents outside the vascular, like if you ruptured one of these thin veins, then they usually put a PICC line in to administer those types of drugs. And that's just sutured in place. It just stays there for, weeks. I don't know how long. Anybody here a nurse? How long can you leave a PICC line in? Anybody know? Okay. This is hidradenitis suppurativa. I mentioned this yesterday. You see all the pustules. Here's the surgery to remove those glands, and it works pretty well. I mean, it's pretty aggressive surgery. He has no feeling in his axillary region, but he probably saves a lot of money on deodorant. This is what a lot of people have. It's a genetic disorder. It's called keratosis pilaris. If you look right here on the back of some people's arms, it's rough. There's a commercial on TV about some kind of cream you put on here. They're selling some cream to reduce the roughness of this defect that you have. Anybody here have it?
Crew has it,
Who?
my 4-year-old. He gets it on his face, and then
But they said that it will appear here later on.
And it's the back of the arm,
Yeah.
not the front. So several people have their arms up. And it is familiar. If you look at somewhere, if you look at the father, mother, the grandparents, it's passed down. So
You can leave it in for several months.
you can leave it in for several, you can leave a PICC line in for several months. Okay? One thing I didn't mention here, I think I'll probably mention it in muscular, when we get to the musculoskeletal class. The different types of fractures. No, I'm not going to mention it now. We'll just go with the surgical head and the mid-shaft fracture of the humerus. Okay, so what we can do from now until lunchish is you can go over and I'll get some more scalpels out and you can start removing. And we're going to have lunch. After lunch, you can come in here and clean this stuff out. It shouldn't take, you should be done way early today. Okay? Is that okay?
I like this stuff so much better. This is like crap.
I'm gonna sign this and turn it in now.
I'll probably watch it over there.
What are your lunch? Are you gonna take it over there? Yeah, I guess we should. We can do it now. I wish my undergrad class would have gone into detail with like the plexus. We didn't.
With the what?
With the plexus.
Oh, my teacher.
Yeah, we didn't. We just did like median radial ulnar nerve. And that's what it was about. Well, you're like
Presentation on that. I'm pretty sure Carly's done this. Yeah, I think so.
Did you have a nice birthday last week?
so.
Gave me that for you. Like, I want to know, like,
I would like it. I'm like, oh, good.